My name is Xin,
My name is Wenxi.
and today we are going to talk about Ali-Health. Over the past decade, Alibaba has had a disruptive influence on e-commerce, internet finance, and logistics. In the past 2 years, Alibaba's strategy has added two new pillars: physical and mental health. The former is in Ali-Health, focusing on health and healthcare. The latter is on Alibaba Pictures. What exactly is Ali going to do in health field? In the words of Ma, the founder and executive chairman of Alibaba Group, it is through the internet and large data technology to enhance the service level of the entire Chinese healthcare industry. At present, the main problem of China's medical service industry is the lack of rationality in the structure of the medical industry, the lack of rationality in payment way, resulting in medical resources distribution irrational, difficulty and high cost of treatment. Medicine and hospital are now divided. Based on that, Ali Health emerged and it includes four sections: cloud hospital, mobile app, cloud platform, and drug electronic monitoring code. Consumers, hospitals, doctors, pharmacies, and all other medical ecology are included. My partner gonna talk in detail about their mobile app next.
There are three main functions of the Ali Health mobile app, which are online doctor, health records, and medicine delivery. And I will introduce them by one in the later section. For the online doctor, this function provides an extra communication channel between the doctor and the patient. It is convenient and efficient because you don't need to make an appointment and go to the hospital yourself. Free consultation is just like consulting a GP. It will provide you basic medical information and give you advice on how to choose a specialist. After you enter the conversation, the system will ask you about your age and gender first, then you can continue to describe your symptoms. After that, recommendations will be provided according to your symptom. Under the specialist section, you can find real doctors who are working in a hospital. It includes specialists from the area of pediatric, dermatology, gynecology, ophthalmology, and so on. Under each of the area, there are a number of doctors you can choose, and there will be doctors' personal information and experience on different medical cases shown. The user can choose the doctor based on this information and choose whoever is best for them. However, the questions you ask are not answered in real time. The doctor will only answer your question when they are free. If you are not satisfied with just text message and want to have a real-time conversation with the doctor, you can choose the third type, which is video consultation. You can directly establish a video connection with the doctor you choose and ask questions. Under this mode, the patient can show the doctors the symptom that cannot be well described in a text message, which is helpful for diagnosis. For the specialist and video consultation, you need to pay the doctor online, and this price is set by the doctor. The online doctor function can help the patient to save time and for simple disease and can help the doctor to earn some extra money. And the next function is electronic health records. Currently, there are four kinds of records you can keep in the Ali Health app, which are blood glucose, blood pressure, fat percentage, and body temperature. Each of these can connect to the corresponding devices via Bluetooth. For example, you can connect to these 8 devices to measure your blood pressure. After connecting, you can measure your blood pressure and the measurement will be automatically recorded in the app. In addition to monitor your own blood pressure, this function is useful when you see the doctor because you can show these records to the Doctor and the doctor can have a better understanding on your blood pressure and how they fluctuate for a period of time, which can help the doctor for diagnosis and prescription. And the third function I'm going to introduce is medicine delivery. Nowadays, almost all people use smartphone. The smartphone has the GPS function which can locate where you are. By making use of this function, health app supports the medicine delivery service, which when needed, the app will find you the nearest pharmacies that support delivery through health app, and you can choose the one that you need. Then you can choose what you need in the catalog of the chosen pharmacy and enter the address for delivery. You can also consult a pharmacist if you are not sure what medicine is suitable for you. After ordering the medicine and paying online, the medicine will deliver to you directly within an hour. And my partner will describe the implication next.
Well, China's healthcare system is so flat that there is hard for consumers to make reasonable choice when using medical resources. Small illness lead to top 3 hospitals because there's not much difference in the incentive mechanisms. For example, the price difference between a doctor of general practice for 7 yuan and a senior doctor of a 3A hospital for 40 yuan don't make much difference. The unreasonable use of medical resources leads to senior doctors spending a lot of time on the treatment of basic diseases. At present, private hospitals are still a small part in the whole Chinese hospital system. And for some complex serious illness, a large number of high quality medical resources are still in public hospitals. But once entered the public hospital system, the problem of structural rationalization arises. Health can perfectly solve this problem. Two of Health's main points. One is to help the primary hospitals become stronger, and one is to build a market-based healthcare system. The weakest part of the healthcare system now is the primary healthcare facility. What Health could cloud hospital platform do, in addition to provide healthcare and IT technology and service to primary healthcare facility, more important is to drag them into the platform, using the internet to give primary healthcare facility a platform to show their capability and to face broad patients. Eventually help primary care agencies to obtain rapid development. Ali want to build such a cloud hospital platform. Participants, in addition to the doctors, patients, clinics, hospitals, will be connected to the third-party inspection institutions, as well as has health insurance, commercial insurance, medicine supply platform, also including some rehabilitation and physical examination services. To form a complete ecological system, the function of the cloud hospital in general consists of all the functions involved in appointment, diagnosis, prescription, and inspection. All institutions on the platform is very easy to get through information between each other. It can greatly improve the efficiency of healthcare, whether it's to the health of patients or to the doctors for the patient's diagnosis and treatment will have a big effect.